Good morning. My name is Krishan Kadiraman. What do these women have in common? Yes, we see them all on TV very often, but that's not all that links them. They all have a higher chance of giving birth to a child with autism. Autism is a neurodevelopmental disorder characterized by impaired social interaction and communication and by stereotypical repetitive actions. According to the CDC, in the year 2000, there was a 1 in 168 chance of giving birth to a child with autism. That number has risen to a chance of 1 in 68. If you are dark-skinned, wear a veil, or recently moved to the United States, that number goes up to 1 in 50. No one is still completely sure about what causes autism, but a recent study has found a link between lower levels of maternal calcium and a high incidence of autism. This is due to three mechanisms. One, a genetic susceptibility to autism may be activated by a lack of vitamin D. Vitamin D plays a role in DNA repair, so insufficiency could lead to higher mutations. And finally, vitamin D has been shown to protect against fetal brain damage. So why is a lack of vitamin D more common in people of darker skin or recent immigrants? The typical Western diet is very low in vitamin D, and as a result, most of the vitamin D required has to be absorbed from sunlight through the skin. People of darker skin require longer exposure to sunlight to absorb the required amount of vitamin D. Especially in colder climates, this is not easy to achieve. When for usually around half of the year, we are bundled up under multiple layers. Currently, vitamin D levels are not screened for at prenatal doctor appointments, as this is a relatively new theory. But every patient has a right to ask their doctor to order a blood draw to check their vitamin D levels. As a nurse, two of the key components of my job will be patient education and advocacy. And I would suggest to any nursing students seeing this to take it upon yourself to educate not only the doctors that you may work with, but also your friends and family who are planning to get pregnant. There is currently no cure for autism, but if there's any way we can prevent it, we should strive to do so. If we can all spread the word and educate people, hopefully we will see a decrease in the rate of autism. Thank you.